For a medical home population of 15,000 members, PSCI EMR-based predictive risk analytics identified 55% more patients early in the disease life cycle compared to actuarial-based claims-driven predictive risk analytics. This translated to an estimated savings of $20 per member per month. What makes PSCI next-generation predictive risk modeling so powerful? PSCI leverages multiple data sources to provide a 360-degree of a patient. PSCI identifies patients with the risk of high-cost intervention in the next 12 to 18 months using a multidimensional risk model. Core to the model is the state of health (SOH) clinical models that predict risk of a high-cost intervention due to a complication from a chronic condition. SOH models are built for each chronic diseases like diabetes, CHF, CHD, leveraging best-in-class evidence-based models. SOH score is a number from 0 to 100 and represents the probability the patient will have a high-cost intervention due to a complication from a disease. PSCI took more than 3 years to develop these models in partnership with clinical teams and make them applicable to care management and population health programs. These models uses the latest patient vitals, biometrics, lab results from the EMR systems and do not use historical utilization history to predict risk. Two patients could have the same clinical risk based on SOH scores, but one could have a higher propensity to use high-cost resources. The utilization scores calculated based on claims data captures this score. Two patients could have the similar clinical risk scores and utilization scores, but one patient could be more non-compliant to evidence-based care than the other. The disparities of care risk score captures this non-compliance risk by patient. PSCI identifies the access to care risk based on patient location, availability of urgent care, type of insurance, and other factors. The socioeconomic score identifies the patient risk based on patient demographics like income, education, family structure. The well-being score captures the state of mental well-being of a patient. How are the PSCI next-generation predictive risk model used? They are used to identify the risk factors for each risk score and design tailor-made care management programs to address them. The scores show the correlation of one risk to the other for a specific cohort of population to decide which care management tools have the highest return on investment. One can start small based on current available data and build over time as more data sources are available. Customer success story. For outpatient diagnostics, customer costs were up by only 1.9% versus market up by 9.7%. For outpatient surgery, customer costs went up by 5.6% versus market at 15%. PSCI, better outcome through better prediction.